Okay, number 180 says soft bone from mineral loss but not volume is osteomalacia. Sometimes you'll see that called rickets. 181, arthritis from old age in injury. That's osteoarthritis. 182, joint capsule. The joint capsule is actually when you kind of think where the bones come together. So if I was to draw this bone here coming down, so here's one of my phalanges. And then there's another phalanx here. And then I've got my tendons coming across here with my synovial membrane. And the question is the joint capsule. And the joint capsule here is what's formed by this between the tendon and the synovial membrane. So that's the synovial membrane. (183) is the membrane secreting lubricant, and that's synovial fluid. 184 is what an untreated ear infection can lead to. I'm going to make this a little bit complicated, but it's very simple. You know, back in time, we didn't have antibiotics, and so therefore a common cause of death in kids was basically an ear infection that was left untreated. So if you kind of think what happens if you were to look at the skull, you'll notice that there's something called the mastoid process of the temporal bone right here. And sitting on the inside of that is actually where the brain is sitting. So the brain is sitting here, it's very thin bone, very thin plate of bone. But if you notice right next to it is the external auditory canal. And right inside of there is where my ear bones are located, where my inner ear. So what happens with number 84, if you want to think of a kind of a story, is that a child starts out with a middle ear infection. That leads to, and that's actually got a name if you want, otitis media. That middle ear infection then leads to an inner ear infection, which is otitis interna. Once you're inside of the inner ear is covered by that mastoid process of the temporal bone, so that leads to a osteomyelitis of the mastoid process. So that's a bone infection of the bone surrounding the brain is really inside of it. The osteomyelitis then moves to the meninges that are covering the brain. So kind of think that if this is my cranial vault, my brain is sitting inside of my cranial vault. So the osteomyelitis leads to a meningitis. The meningitis then covers the brain, and the meningitis gets infected, and that leads to an encephalitis, which is a infection of the brain, and of course, left untreated, that leads to death. Well, so back in time, what they used to do is they would remove the mastoid process of the temporal bone before we had antibiotics and do an incision and drainage, but basically you'd lose conduction hearing loss of that ear. So the whole back of the plate back here would be just skin, and you'd literally lose hearing in that ear. Once antibiotics came on the market, and probably everyone has taken that, they took this little pink fluid, which is amoxicillin. It was either pink or purple fluid, and that controlled it. You would get earache after earache after earache, and sometimes they'd put myringotomy tubes in to control it. The problem is now we've got so much antibiotic resistance that children are dying from middle ear infections. So it kind of tells you the good and the bad of the things. 185 is bacterial bone infection. I just said it, it's osteomyelitis. What's the bacteria that most commonly causes it? So that's number 186, and that's Staph aureus. 187 is the Lyme disease. Remember, Lyme disease basically comes from a tick. The tick then passes it on to you, and so therefore it develops an arthritis. And since it's an arthritis from a tick, it develops what's called an infectious arthritis. We can't ignore a tick bite. You know, a tick bite commonly forms a wheal. So when you get a tick bite, you'll find that it forms actually something kind of looks like a wheel around it. That tells you that you've got a tick bite. That means you've got Lyme disease is spreading. You can very commonly treat it with doxycycline. Problem is people oftentimes wait too long to take the doxycycline, or they don't see the tick bite, and as a result, within 4 to 6 weeks later, this now spreads systemically, and it can be a lifetime pathology to deal with and a lifetime of pain. So it's one thing you want to be very careful about tick bites. 188 is the hollow tube of compact bone. That's just answered by the word diaphysis. 189 is the marrow in the diaphysis. Remember, that's yellow marrow or fat. 190 is the connective tissue covering the shaft. Remember, that's called the periosteum. That's what actually, when you get a shin splint, when your muscle has a tendon that's attached to the bone, when you get a shin splint, you're actually tearing away the periosteum from the bone itself where the tendon attaches. And that's why you have to use some rest and probably some type of compression stocking or something to try and let that heal and allow that periosteum to, again, get tight to the bone itself. 191 is another name for the dens. That's called the tooth or the odontoid process. Remember, the tooth or the dens or the odontoid process is that superior facing process of C2 or the axis, and it's that axis there that allows for the atlantoaxial joint to give me rotation of my head. And that's why, of course, it's very easy to get paralyzed when you get a fracture or somehow damage that dens, because it has nowhere to go except directly into the spinal cord. Number 192 says the joint where you find the dens, and of course the dens is at the atlantoaxial joint. 193 is the bone that contains the dens, and again that's the atlas. 194, concentric rings in an osteon are called the lamellae. They look very much like growth rings of a tree. 195 is the stage is cell division. Remember, that's mitosis. 196, stages of mitosis. Remember, I said there's really 5. It's going to be prophase, metaphase, anaphase, telophase, and interphase.
Hold on. I'm going to keep it rolling, but I'm going to try to fix that. It's really dark.
Oh, the lights here won't help, huh?
I mean, it will. No, hold on.
Oh.
But it's going to
No.
be real bad.
What is that thing? Where is that coming from?
This is this camera. It's this camera here.
This is doing that?
Yeah.
But what's that shadow coming
It's
down?
this light and this light, but I'm losing light throughout the whole room
Okay.
because of the window.
We're almost finished. Any ideas how we can...
Well, I'm doing it right now.
I know, I'm just... If I kill the shades, would it help?
No, it'll make it worse.
Oh, that's not bad.
But it's going to change. The problem is
Well, let's see what it does with this. It's not too bad.
but it's going to change every time you move your hand and write something.
We're almost there, though. Let's try it. 197. Is it rolling?
Yeah, I never stopped.
197 says where the spinal nerves pass through the vertebrae again. Well, as they pass through, they're going to go through two places. So if you kind of think, the spinal nerves now are coming out of the intervertebral foramen. So again, if you think of a vertebra, right here, there's a little notch that's formed. So coming out of here is my which between vertebrae. So it's that little notch that you have between vertebrae. 198. 198 says the inner portion of IVD, that's the nucleus pulposus. Significance says a high water content. 199 is the content of 198, and I just said it's water. That's why we shrink as we get older. We shrink when we get injury because we lose that water, that cushion effect. And of course, at the same time, it causes entrapment or impingement of the spinal nerve and causing us pain or loss of motion. 200. 200 says cartilage tight. 200 says soles face each other. When my soles face each other, that means the bottom of my feet are facing one another. That's called plantar inversion. 201. 201 says the number of bones in the pectoral girdle. Well, pectoral girdle, I've got 2 clavicle, I've got 2 scapula, so that's 4 bones. 202. 202 says number of bones in the pelvic girdle. Remember I told you I've got 6 bones. I've got 2 ilium, 2 ischium, and 2 pubic bones. 203. 203 says location of the lateral epicondyle. Well, you know, if you think about your femur, for example, and you look at it, you know that this femur has to articulate, and since this is the distal femur, it's got to articulate with the tibia and fibula. So therefore, these kind of bony processes on the side are actually the epicondyles in that. So the question number 203 says the location of the lateral epicondyles. They're on the lateral aspect of the bone. And it's in the bone, you could say, of the joint. And so that's where you're going to get your attachment, and that's going to get your ligaments and tendons passing across. 204. 204 says cartilage type intervertebral disc. Remember, an intervertebral disc is going to be fibrocartilage. It's not going to be hyaline-articular cartilage like we have on our joints. It's going to be fibrocartilage. 205, cartilage type in the pubic symphysis. Same thing, fibrocartilage. Where the pubic bones come together, forming that amphiarthrotic joint that's used for childbirth, that's going to be a piece of fibrocartilage. 206, articulation superior to C1. Remember, C1 is the atlas, the first cervical vertebra. Remember, sitting above that is the occipital bone. So the occipital bone is going to articulate with the atlas by the occipital condyles. And so forth. When the question asks the articulation superior to C1, that's going to be the atlanto-occipital joint. 207, the bone containing auditory meatus. Well, if you look on the side of your right here, you notice that I've got my auditory meatus right here. So that's again the temporal bone. 208. 208 says the largest foramen in the body. That's going to be in the pelvic girdle. That's going to be the obturator foramen. Easy way to remember that is think of a doctor that takes care of delivery in women as an obstetrician. And so just think of the pelvis, and just remember the obturator foramen is located in the pelvic girdle. The significance of really knowing that is because there's a process where the sciatic nerve, the greater sciatic notch, passes through that obturator foramen, which is the cause of sciatica. So oftentimes, when women are pregnant, they get this pain running down their left leg, and that's because the vertex of the head is actually crowning down against the greater sciatic notch. 209. 209 says the largest. 209 says the largest foramen is skull.
Give me 1 second. We'll start 209 again. I'm just getting a little feedback on the audio. Count to 10 for me.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay.
209. This is the largest foramen is skull. That's the foramen magnum. Remember, the foramen magnum is going to be in the occipital bone. So that's your foramen magnum right here. That's the largest foramen in the skull. The largest foramen in the body is in the pelvic girdle. 210. 210 says number of axial bones. Remember, the axis is going to be 80 bones. 211. Number of appendicular bones. Remember, we said the magic number is 126, even though it theoretically would be 130 if we took and broke the pelvis into 6 bones instead of 2 os coxae. 212. Number of floating ribs. Remember, it's 7 pair of true, 3 pair of false, 2 pair of floating. So the number of floating ribs is going to be 2 pair or 4. 213 is another name for 212. So therefore, since they just attach to the vertebrae, they're called vertebral ribs. 214, suture between the parietal bones. The parietal bones have got the sagittal suture running down the middle of them. So if I take my calvaria and sit it up here, I can see that these are my parietal bones. So that's frontal up here, occipital's back here. These are my parietal bones. That's going to be my sagittal suture. (215) Sutural bones. I told you there's little bones that sit inside of the sutures. Those are called Wormian bones. So again, if you looked inside of a suture and you said it looks like this, these little bones right here and here and here are called Wormian bones. 216. 216 is the notch on the sternum. Remember, that's the jugular notch or the suprasternal notch. Remember, that's going to be a landmark for a tracheotomy. 2 fingers above that notch. 217, large calf muscle. That's your gastrocnemius. That's the muscle, when we start learning muscles, is going to be called the main muscle for plantar flexion. Remember, plantar flexion is standing on my toes. Remember, that's what a ballerina does. So kind of think that's called oftentimes your ballerina muscle. 218. 218 says muscles for plantar flexion. Well, again, muscles for plantar flexion are going to be the muscles that are going to cause me to stand on my toes, and that's why they're the ballerina muscles, and that's going to be the gastrocnemius, the soleus, the plantaris, and the tibialis posterior. So the main muscle for some type of action is called the agonist. So that's really the agonist. But the muscles that assist those muscles are going to be the synergists. So just think that, one dangerous thing we oftentimes do is we avulse our Achilles tendon, which is the strongest or longest tendon in the body, the largest. Well, when we avulse or damage our Achilles tendon, rip it off, that means that none of these muscles are literally attached at all to the foot. So that's why you have to do a graft and sometimes put a screw in there, try and fix it. And it's very, very painful. A lot of physical therapy involved. 219 is the tooth socket, and the tooth socket is called the alveolus. Remember, we've talked about the alveolus. If we've got 32 adult teeth, we've got 32 alveoli. If we've got 20 deciduous or baby teeth, we've got 20 alveoli. Remember, it's the periodontal ligament that's going to attach the tooth to that socket. And it's that periodontal ligament that gets inflamed with periodontitis, which is the #1 cause of tooth loss. 220 says what holds a tooth in a socket, and now that's your periodontal ligament. 221, another name for the cribriform plate. Well, the cribriform plate is what's really coming down and separating is part of your nasal septum. So as I look up here inside of the cranial vault, I can see I've got the cribriform plate in this area called the crista galli. The cribriform plate, since it goes perpendicularly down in here, making up the top of the nasal septum right there, that's why that's called the cribriform plate is also called the perpendicular plate. That's why you want to be so careful hitting someone too hard in the maxilla or in the nose, because theoretically it could cause it to push up, and what's sitting right above it are actually the circle of Willis in your brain. And of course, that's the main blood supply, so it would probably cause an instant death and actually no way to repair it. 222, bones of the nasal septum. Again, remember, nasal septum is comprised of four bones. You've got your maxilla at the bottom. Remember, maxilla are two fused, so the two maxilla. You've got your vomer in the middle, and you've got your ethmoid at the top. Remember, the ethmoid has got the cristagalli cribiform plate, so it's 1, 2, 3, 4 bones make up a nasal septum. 223 is the bone contains the zygomatic arch. Well, that's again going to be the temporal bone. So the zygomatic arch is right here. It's temporal bones here. Here's my zygomatic arch here. And there it's going to connect up here with the malar bone. But the majority of the arch here is actually formed by the temporal bone. 224 is the bone, let's see, 223 is, oh, I'm sorry, 223, this is 224, I missed it. 223 was another name for the malar bone, that's the zygomatic. So 224 is the bone contains a zygomatic arch, that's the temporal bone. 225 says the bone that contains the mastoid process, that's the temporal bone also. 226 is the heel bone. Remember, the heel bone is the calcaneus. So remember, the heel bone is significant because it's the heel, but also it's one of the tarsal bones, and it's also considered an ankle bone. So when someone says, what's the heel? Well, the heel is the calcaneus, but it's also a tarsal bone. And because it's a tarsal bone, it means it's also an ankle bone. So just think tarsal bone, ankle bone, calcaneus, and of course that's going to be the attachment of the Achilles tendon for those muscles of the gastrocnemius, soleus, plantaris, tibialis posterior. 227 says the bone that contains the cristagalli, and that's the ethmoid. And again, I can see that right here as I look inside of the cranial vault. This is your cristagalli sitting on the side, so that's in the ethmoid bone. 228 is the nerve passes through 227. And of course, the nerve passing through that's going to be for smell, so that's the olfactory nerve. Remember, the olfactory nerve is cranial nerve number 1, and it's always central nervous system. Significance of that again, if you punch someone too hard in the nose, one thing you can do is kill them because you're going to actually sever the circle of Willis, but you could also permanently damage and cut through the olfactory nerve. Remember, central nerves don't grow back. Peripheral nerves do. If you were driving your car and you hit your knee against the dashboard, you'd probably have some loss of sensation for 6 to 9 months, but it would come back. That's the peripheral nerve. But a central nerve, like the cranial nerve 1 and 2, if you cut that nerve, you are never going to retain the sense of smell. And the sense of smell is very closely related to the sense of taste. Same with the optic nerve. You cut that optic nerve, it is not going to grow back. You're going to lose vision, lose sight. Remember, those two nerves are always central. 229. 229 says standing in a calcaneus. Remember, stand on your heel. That's going to be dorsiflexion. Remember, that's what we're doing in the anatomical position. 230, stand your phalanges again. That's plantar flexion. Remember, that's using the ballerina muscle, the gastrocnemius. 231, it says the pollex is blank to the digiti minimi. Remember the thumb, okay? So remember in your anatomical position, when I'm in the anatomical position, my anterior surface of my palm is facing forward. And the question is, my pollex is what to my digiti minimi? And the answer is it's lateral. You have to be careful when you're looking at your hand or your feet that you're always thinking you're in the anatomical position. 232, it says a temporary joint. Temporary joints are the joints that are found at the growth plate or epiphyseal plate. So when I drew that very simple long bone to show you what it looks like, there was a region right here that's at the metaphysis of the bone called the growth plate or the epiphyseal plate. And it's that growth plate or epiphyseal plate that controls the growth of something. And so therefore, because that's got some cartilage inside of it, that forms what's called a synchondrosis. So a synchondrosis is a temporary joint because, think of the example. The 45-year-old man gets on a skateboard. The 15-year-old kid is on a skateboard. They both fall down. The 15-year-old gets up, dusts himself off, and goes on his way. The 45-year-old ends up having $150,000 of reconstructive surgery with pins and rods and probably, 2 years of physical therapy. Again, because there's a little bit of flexion in someone under the age of 15. So those synchondrotic temporary joints are generally gone by the age of 15 or 16. But they're also something to carefully watch in an injury. So if you had someone under the age of 15 and they fell down on their arm, you'd really have to watch the way it was casted if the fracture was at the growth plate or the epiphyseal plate, because working that improperly and casting it improperly without the physical therapy can end up with someone having a shortened arm. 233 says another name for the growth plate. We already said that. That's the epiphyseal plate. 234 is the carpus is what to the metacarpus. Well, if this is my carpus and that's my metacarpus, this is proximal to. This is distal to. So the question is, my carpus is what to my metacarpus? It's proximal. 235 says cells in the mastoid process. Remember when I told you the story about the ear infection? Child gets a middle ear infection, goes to an inner ear infection. In-ear infection goes to the mastoid process of the temporal bone. But when you open up the mastoid process here of the temporal bone, so it's that bump right here that you can feel in the back of your ear, when you literally look inside of it, you see all these little pockets that are called air cells. And what happens, the pus goes inside of there, and as a result, it's very hard to get rid of that infection because it's got very poor blood supply. So therefore, the cells in the mastoid process are called air cells. We've got that same issue with the prostate gland. It's got a very poor blood supply, but it's kind of spongy, and it's very hard to control a prostatitis. 236, it says openings on the anterolateral mandible. If you look at your mandible, your lower jaw, there's two little openings right here. They're called the mental foramen. They're for the passage of blood supply and nerves to the jaw. 237 is the flat lateral process of the mandible. you know, on the side of my mandible as it goes up. So if you kind of think the mandible kind of looks like this, kind of comes down, and here's where it is. So right here, this flat process here is actually going to have a name for it, and that's called the ramus of the mandible. A lot of times when people have a broken jaw, they fracture their ramus. 238. 238 says joint of the mandible with the skull. That's the TMJ, the temporomandibular joint. That's the one that when you close your jaw, open and close your jaw, you hear kind of a cracking sound. A lot of people have TMJ. They can use an appliance to try and kind of control it at night, but again, something that's not real easy to get rid of. It's very hard to retrain those muscles of mastication. 239 says cartilage is just something for bone deposition. Remember, cartilage is nothing more than a template. You can't turn cartilage into bone. You can just take bone and deposit bone cells where cartilage cells were. 240. 240 says cartilage, what becomes bone? And the answer is never. Never, never, never. You can never turn a cartilage cell into a bone cell. You can never turn a chondrocyte into an osteocyte. All you can do is use that as a template for osteocytes to attach to. So just remember, that's why we have cells called osteocytes, osteoblasts, and osteoclasts. 241. 241 says the joint between the xiphoid process and the body of the sternum. Well, if this is your sternum and this is your xiphoid process over here, it's called the xiphi-sternal joint. That's the one that oftentimes is broken in compressing the chest in CPR. 242. 242 says attaches muscle to bone. That's a tendon. 243. 243 says men have a pubic symphysis. True or false? And the answer is true. Right? They have a pubic symphysis, but they don't use it. Remember, the pubic symphysis is used for childbirth. 244. 244, Christogalli is on the sphenoid bone. That's false. The Christogalli is a process of the ethmoid bone. 245 is there are 30 bones below the pectoral girdle. Well, let's think about that. Let's see. My pectoral girdle is going to be my clavicle and my scapula. So let's count the bones below that. Well, let's see. The first bone would be the humerus. So that's one. Below the humerus, I've got the radius and ulna. Making the forearm, that's 2. Below that, I've got the carpus, or the wrist, and that's 8. Below that, I've got the metacarpus, and that's 5. That's the palm. Below that, I've got the phalanges, and that's 14. So 14 and 5 is 19, and 8 is 27, 29, 30. So there's 30 bones below the pectoral girdle on one side, 30 bones below the pectoral girdle on the other side. So when it says how many bones below the pectoral girdle, it's actually 60 bones, right? 30 bones on each side. So that's why that answer is false. So always kind of think the way the question is asked. Number 246 says there are 16 wrist bones. True or false? That's true. Remember, there's 8 carpal bones in each wrist. 247. Perpendicular plate joins the nasal septum. True or false? The perpendicular plate is the upper portion of the nasal septum coming down from the ethmoid bone, so that's a true statement. 248, it says there are 86 axial bones. No, we know there's only 80 axial bones, so that's false. 249, bones in the pectoral girdle. How many bones in the pectoral girdle? We've talked about this. We know we've got 4 bones making up the pectoral girdle. We've got the 2 clavicle and the 2 scapula. So therefore, number 250, the last one, is the number of bones in the pelvis and pectoral girdle. Well, if we got 4 bones in the pectoral girdle and we got 6 bones in the pelvic girdle equals 10. So it's 10 bones. Well, that ends the lecture on bones, and the next time we talk, we'll talk a little bit about the review and the exam. Thank you.